Vice President of Operations, and I love your outfit. Very, very sharp, Nancy. So after my briefings, as we have done before, so they can get back to their important work being done at Bay State and Mercy, they will speak, and then we'll have the press ask any or all questions pertaining to Bay State and to Mercy. I want to thank our trio that is here, sign language. Thank you very, very much again for being here. We appreciate that immensely. Let me get into, first of all, the statistics. We continue to trend on a good note. Friday, 6 new. Saturday, for the first time in about 5, 6, 7 days, it was 13, but Sunday back down to 7. So that's quite new cases. That's quite an improvement compared to the days when we report 104 and 60, 70, 80. So our total is now 2,583. Unfortunately, we did have 2 more deaths, and condolences, thoughts, prayers, and sympathy to the affected families. That brings us to 117 deaths in the Springfield area. 55 are white, 34 are Hispanic, 26 are black, 2 are Asian. Long-term care, 54 have passed, 63 residential. Now, Helen and I are always on the ball when it comes to opening up cooling centers. And unfortunately, due to the COVID-19 and the coronavirus social distancing, we cannot at this time. But we will be announcing that we're going to have sites where we'll give out water sites will be given out, and we'll announce that very shortly. And we're going to continue to deliver meals to our seniors. So cooling centers, unfortunately, for right now, we cannot do. But water stations will be announced very shortly, especially for our seniors in need. But we are still doing those senior deliveries of food. On the public safety front, Commissioner Cheryl Clapwood indicates that she is down 2, and they continue to work around the clock on those homicides, those murders. Again, they are thoughts and prayers to sympathy, affected families on both sides, and this goes to, again, gangs and drugs. They've taken off just this past few days. 10 more guns were seized off the streets. Fireworks continues to be a royal pain in you-know-where, and I know the council has something before tonight, but I'm going to file home rule legislation. You got to really get their attention, because what they're going to do is, I don't care if you give them a $3,000 fine, they're going to rip that ticket up right in front of you. So I'm going to look to do a home rule legislation to tie it to something they really need. Get their attention. Make them think twice. And what is occurring with these fireworks is now, whether they're shooting them out of cars, whether they're stopping right in the middle of the street, shooting them and taking off, almost terrorizing neighborhoods. We've made confiscations, but I'm going to attach, and I'm going to do a home rule. I spoke with Solicitor Pakula earlier this morning that would attach to any licensing, license, registration, excise tax, anything to do with the city. So now you're going to think twice if the city council will pass that, and then it'll get to the legislature, but this is absolutely ridiculous. The last 2 fires that Commissioner B.J. Calvi's crew had to go put out, this recent one in Bloomfield Street, 3-car garage, fireworks. Orchard Street in the North End, shooting fireworks into a 2nd floor window, injuring a person. Absolutely disrespectful and ridiculous. This is not child's play here. And you wonder why at times we have to clamp down. Total disrespect on that. We're also on the police side, again, 2 out. They continue with the arrests. Many of those arrests, and the arrests that have been made are just recently. You will see that once again they are repeat violent offenders. One was on probation that was let go by our courts to be put back on our streets and in our neighborhoods to wreak havoc to all our residents, no matter what creed, color, and background. And when they say, Sarno, what are you doing about that? Clapperwood, what are you doing about that? What are we doing about that? We arrest them left and right. The courts need to hold these individuals. Also, with DPW, and it was great, everybody loves to see Chris Signoli, the street sweepers out there. They love to see. I saw them again out there early this morning. They're down one. Back to fire, Commissioner Calvi is down one also. We've had no issues, and I want to commend all my cabinet heads, department heads who have worked on the restaurant dining, outside dining. There has been no issues whatsoever outside. Today's a great day. The restaurants are able to reopen following the COVID-19 coronavirus rules and regulations, so they're able to go inside. So that's extremely important. Pat Sullivan indicates to me we're on record that the splash pads, we're trying to get them open ASAP, but they should be open by next week with the proper supervision that is there, so they'll open next week. The golf courses have been going fine. Another thing too, and I want to thank Pat Sullivan, and I want to thank Tim Sheehan, my Chief Development Officer. Use CDBG funds, movies in the park. We brought that back through my administration, very, very successful. People love it. It's a great family gathering. We feel we can do it with proper social distancing. And I want to thank Mariel Baez, who sent me a nice email earlier about not only the family fun movies, but if we can do something, if the rental is available, family, age appropriate, pertaining to the struggles of our black community as far as engaging and spurring constructive and respectful conversation and dialogue. I think that's something that we're going to look to pursue. On the school side, Superintendent Dan Warwick indicates to me we're nearly at 1.3 meals served. That's at 18 different sites. That's breakfast, lunch, dinner, and snacks. We will continue with John Foley at Central High School on Fridays. The Oasis Food Bank, 3,500 families have been continually served there, and that's with meats also and milk. And these sites will continue to stay open all the way throughout the summer. I've asked them to stay open throughout the summer, and partnering with Sedesco and the Food Bank of Western Massachusetts. Superintendent will speak a little bit. He continues his team to work on the fall reopening. Summer program, educational program is moving forward. All the laptops, all 17,000 of them, will continue to stay out. The graduations went very, very well, the virtual graduations, and some that were done in person by the principals. Superintendent indicates to me he'll speak a little more. I think there was like 200,000 views on those graduations, which is tremendous. Tim Sheehan, and Chief Development Officer, Phase 3 of our Prime the Pump initiative is out. Another $500,000. That makes $1.225 million in grants given out by the city of Springfield to get our businesses, restaurants back on their feet. This $500,000 is to help businesses who have not been able to reopen. Tim indicates to me early this morning that the applications are coming in very, very quickly. Another initiative that Mr. Sheen and I have spoken of is that we're starting in the planning stages, targeting CARES money to workforce development programs and plans targeting the black and brown community. So stay tuned for that. Also, on revenue side, my CAFO TJ plan indicates revenue loss again is $4.6 million, and we've deficit spent $6.9 million. And as we've done with other natural man-made disasters, I will go after any and all, every dime I get my hands on, whether on the federal and state level, for reimbursement for the residents and the business community of the city of Springfield. We are also, you see, Juneteenth. The Brethren always holds a great, great event that I participate every Juneteenth. Usually it's on a Saturday at the Ray Jordan Senior Center, packed. great program of play, entertainment, speaking, and great food. Because of the COVID-19 coronavirus, they couldn't do it. So I had reached out to some of the brethren and said, you know, as we've done with other events and occasions, we need to recognize this and celebrate it. And we had a really nice crowd out here in City Hall steps. Gave a proclamation, had the brethren speak, we raised the flag, so that was very well done. I'm glad we did it. Congressman Neal, I was with Richie, Chairman Neal, at Union Station, the infrastructure federal legislation that he is spearheading. This massive plan is the largest since the President Eisenhower interstate highway program of the 1950s. And he and I will always say, with public investment spurs private investment, which creates a good four-letter word, J-O-B-S, jobs. And then the last thing I'll say, I continue my community meetings. I'll be with the Girls Club Family Center this week, and I'll be with the Pioneer Valley Project Youth Voices this week too, as we continue to have constructive dialogue as we move forward in a mutually respectful way with race relations. We've come a long way, but there is more to be done and better understanding and dealing in a respectful manner. Last thing I'll say is, and I said it at the press conference at the police department with Commissioner Clapper Friday, with some of the gunplay that has gone on, the uptick. You know, I received a phone call from Minister Alexander, and I had a really nice conversation with her late Thursday afternoon, early Thursday evening before my school committee meeting. And she had left a note. Her note was, Mayor, please stop the bloodshed. I'm crying, a mother pleading for you to stop the killing, which we all agreed to, and I explained the situation, what was going on. But what she said to me really struck me. She had said, you know, we have these protests, we have these march. Where are those? Where's the community? Where's our community? Where's the families? Why aren't they upset about what is occurring with these gangs and guns? She said that to me. She goes, there has to be accountability, and everybody has to work together here. And I told her some of the arrests we made or the people that are involved, and it doesn't matter if it's gangs or guns. You still have two families that are affected, and someone's lost their lives. But again, I told her that those individuals that we arrested or following leads now are repeat violent offenders that were put back on the streets. So it was a very moving conversation. I appreciated that, saying that you know, the community needs to do their part too, and moms and dads have to step up. So we're following leads on those, and I look forward to Commissioner Clapper and the brave and dedicated men and women in blue to arrest them, and hopefully the courts will hold them. I know Helen will be coming up too, and we continue to work on our Office of Racial Equity, putting that together to look at all different variations of that, and you know, we'll work on getting community input also with that. So we are making tremendous strides all around. We can always do more, but on this COVID-19 coronavirus, as I stated before, that we will defeat this COVID-19 coronavirus. We've been working very closely with Bay State and Mercy, knock on wood, if and when needed, if there was an uptick capacity-wise, that they could handle it. But I think Nancy's going to tell you, Dr. Roos is going to tell you, Helen's going to tell you, we need to stay ever vigilant. So you need to wear those masks when you're out there. You need to social distance. You need to wash your hands. If you don't feel good, stay home. This is paying dividends, and it really shows. Governor Baker and team have done a tremendous job. My team here in Springfield has done a tremendous job. I'm going to say that because they're tested and true. You look at 22 other states across the nation, whether they opened up early or didn't follow certain procedures, and I wish no ill will. I've always said right from the beginning, I didn't want to take one step forward and then end up taking 2 steps back, which is demoralizing. And you see other states now that are re-shutting down. So we based the decision of balancing act. I want to get businesses open just as quickly as each and every one of you viewing, but we got to do it on the health, science, and medical aspects, and so far it's paying dividends. So with that, I'm going to bring up Nancy from Bay State, and I thank you so much, and then Dr. Roos, and then we will take questions immediately for both these health professionals so they can get back to Bay State and Mercy. Thank you very much. Nancy. And great outfit again, too.
Thank you, Mayor. And thank you to the media present who are continuing to share updates in our community. And I am pleased to join you today. Mayor, I hope you had a wonderful Father's Day, and to all the dads, I hope it was a wonderful weekend. I know the celebrations had to be very different this year. We can celebrate the downturn in cases, and I commend all of those in our communities who are committed to following the guidelines of wearing masks, social distancing, and hand hygiene, as this makes the difference and helps to keep all of us safer from COVID-19. So for the numbers across Bay State Health, here are the latest. The total tests, 20,704. Those that were positive or detected, 1,896, which is a 9% positive rate. Those not detected, 18,779, 91% of the total tests. And those that are deceased are 228, which reflects 12% of those that tested positive. And we do mourn with those families. Our numbers across the system at all Bay State Health hospitals and the community hospitals as well as the medical center continue to trend down. And as of this morning, we have 19 cases across Bay State Health with 3 in critical care, which represents only 3% of the total patients that we are caring for having COVID, and 97% being hospitalized for other conditions that are non-COVID. So at Bay State Medical Center this morning, 617 patients and 97% non-COVID. So we are pleased that our community members are returning for care that they might have put off, or new healthcare needs that are emerging. Just as our Bay State team adjusted to change when COVID-19 struck our community, we have adjusted to welcome our patients back. Our protocols for entry have changed, with screenings and temperature checks for everyone entering Bay State facilities, and our commitment to the safest and highest quality care continues to be the #1 priority. As the president of Bay State Medical Center and as a nurse overseeing the operations, we continue our commitment and privilege to serve all members of our community. And as I make rounds and I'm going to specifically talk about nurses, they are pleased to have been able to step up. They've been flexible, they've been adaptable over all of the changing guidelines. They have demonstrated tremendous teamwork. And one of the nurses, her name is Taylor Hoffman, said, "I don't like to be called a healthcare hero. This is what I love to do." And I am so proud of the resilience as we go through this pandemic. At Bay State Medical Center, the region's only academic medical center with a focus on teaching and research, we continue to offer experimental treatments. So we have a total of 63 COVID patients having received remdesivir. 53 patients have received convalescent plasma, 13 have received IL-3, a monoclonal antibody, and a new trial will be coming soon combining remdesivir and IL-3. We are also beginning antibody testing this week. So we continue to offer COVID testing at 6 sites, and additionally, Bay State Health supported the request by Governor Baker to participate in the Commonwealth Initiative to offer free COVID testing to anyone who had attended a large gathering in the past couple of weeks. This testing was offered at 50 locations throughout the Commonwealth, And on June 17th and 18th, Bay State Health had locations in Springfield, Westfield, Greenfield, and Ware, in which 1,334 people were tested, and of that, 14 were positive, which is a 1.05% positivity rate. We also made sure that anyone that was tested, because you did not need an order, had access to a physician for follow-up. So while things are quieting in Western Massachusetts, there are more than 12 states across the country that are reporting 7-day averages of 10% or more increases in cases. We're not protected from the virus. There are 20,000 cases per day and 800 deaths every day. There are 8 million cases now worldwide, with growing outbreaks in South America, Asia, and Africa. We must all stay vigilant and continue to wear masks, social distance, and practice hand hygiene. It's certainly challenging for all of us, but this is what makes the difference, and this is what is driving the decreased rate of COVID in our communities. So our phase 2 reopening is progressing well, and we are now providing preventive, chronic, urgent, and emergent care for our patients. Bay State Health is committed to keeping everyone safe. We want to care for you and are following the guidelines set forth by Governor Baker and the federal government. We adhere to strict standards of screening, wearing masks, and social distancing. And so I'm going to tell you a little bit about what we are doing and what we are asking you to do. So first, we are rigorously and continuously cleaning our facilities and disinfecting, and we are cleaning our hard surfaces as well and maintaining strict hand hygiene protocols. And we are asking you to follow hand hygiene guidelines, including the convenient use of hand sanitizers throughout our facilities. In terms of screening, we are screening all patients and staff upon entry to our facilities. And we are asking that if you do not feel well, you do not come to our facilities, you call your provider for an appointment or procedure if you are feeling sick. In terms of masks, we are requiring everyone to wear masks, both providers and patients going through our facilities. And we are asking you to wear a mask. We will give you a mask if you don't have one, and you can certainly wear your own. And in terms of social distancing, we have redesigned our waiting rooms to support social distancing. And we are asking you to adhere to the notices and signs that comply with our policies. We are also asking you to comply with our visitor policy. And so I am thrilled that we are now able to allow one visitor per patient. This has been a very hard journey to receive patient care when you cannot have a loved one at your bedside except for very special circumstances. So we are so happy that we can welcome visitors back. We are, though, having visitation hours from noon till 8 o'clock. Visitors can expect to be screened upon entering the facilities. They are required to wear masks, and they are not permitted in our common areas, our waiting rooms, our cafeteria, or our gift shop. It's all to limit the total numbers in the facility at any one time. And visitors are asked to travel directly to and from where they are going. We also still are encouraging electronic visitation. We use iPads to connect patients and families every day, and that works extremely well. And in our outpatient areas, visitors cannot accompany patients. Again, we are adhering to strict guidelines, except if there is obviously a parent with a child or a completely dependent patient that has a companion with them. So as we open up, we must practice preventive measures, including social distancing, masking in public, and hand washing. We continue to focus on ensuring that we keep our patients safe, our staff safe to be able to care for you, and we are confident and ready should there be a surge. We know that for any reason, if we need to build capacity across Bay State Health, we have the ability to do so. but we don't want to take our eyes off how we control this virus and control the spread. And so if you have other information, I refer you to the Bay State Health website where we continually update our information. Thank you very much for your attention.
Thank you, Madam
Thank you,
President.
Mayor.
Dr. Roos from Mercy Trinity Health System. Thank you, Dr. Roos.
Good morning, everyone. I am going to follow the trend that Dr. Kerouac and I started last week by just removing this while we speak, as long as there's appropriate distance here in Phase 2. Mayor, thank you today, and happy Father's Day to you, and thank you to all the commissioners for the ongoing incredible work that's being done here in the city of Springfield. I also want to extend my gratitude to the Western Massachusetts Legislative Delegation as you continue to fight for parity for several critical services, including through legislation for the support for funding for telemedicine services at an equal rate to those delivered in person, as that is a critical intervention that we know brings quality and something that has come about in much greater numbers now that we have entered the COVID pandemic. I also want to wish all the fathers and the supportive father figures a wonderful Father's Day and hope you had a great weekend. It's important that even during these times that we still take an opportunity to celebrate the important people in our lives and those that have taught us many things. I had a chance to Zoom with my own father who lives in Chicago, an engineer who turned science teacher. And I've reflected on the fact that many things that he taught me over many years have come in handy during these incredibly unprecedented times. Things such as having an open mind and being able to search for the truth, having a strong sense of fairness, having an optimistic heart, and most of all, I think his passion for science and data. And so this morning I'm going to start with some statistics that put in perspective where we've been and provide some perspective on where we might be going. Today's June 22nd, and it's hard to imagine, but it's only been 170 days since the Wuhan Municipal Health Commission in China reported 27 cases of viral pneumonia being treated that later were to be found to be the novel coronavirus. It's only been 148 days since the first confirmed infection in the United States, and 138 days since the first confirmed infection here in the Commonwealth of Massachusetts. But in the 5 months since, we've seen now nearly 9 million confirmed cases across the globe, nearly 2.3 million confirmed cases here in the United States, and over 107,000 confirmed cases across the Commonwealth. There have been more than 26 million tests reported in the United States, and now, as was mentioned, there are dozens of countries and areas across the globe in at least 18 states that are seeing increasing numbers of new infections. 12 states recorded their highest number of new infections in a single day in the past week, including California, Florida, Missouri, and Oklahoma. We also know that the numbers of infections are not only represented by increasing numbers of tests being performed, because the percentage of positive tests and the numbers of hospitalized cases are continuing to increase in those states. We need only to look at cities like Houston, where the numbers of patients hospitalized has doubled in recent weeks, or Phoenix, for the evidence of that. Here in Massachusetts, we do continue to move in the right direction, and it's behalf of the efforts of all of you. With declining numbers of hospitalizations and declining percentages of positive tests. For some context, in the month of May, the Commonwealth of Massachusetts saw over 11,000 admissions to hospitals for COVID-related illnesses. And now, as the numbers are declining, what's projected over the first 20 days of June is to bring that number down to about 9,000 or even perhaps below. What that means is in June, there are about 315 patients so far that are being admitted to hospitals for COVID, but 350 that are being discharged every day with COVID from hospitals. So the numbers of hospitalized patients across the state continues to decrease and now is less than 1,000 over the last week for the first time since the beginning of the pandemic. At Mercy, we've treated more than 700 patients with confirmed COVID infection in our emergency departments and in our hospital units. We've discharged more than 90% of those patients back home to safely recover. And as of today, we have 6 hospitalized patients with confirmed COVID infection, none of which are in the intensive care unit. And our numbers over the last week have ranged between 4 and 6. In regards to testing, we've tested 15,480 with 2,705 positive tests and over 12,600 negative tests. Our percentage of positive tests once was around 30 to 40%, and now is between 2 and 5% on a daily basis. And we've had several days without any positive tests through our emergency department or inpatient units. And so, as I said last week, this is good reason for us to support continuing to slowly resume services. But we are not yet at a point where we can breathe a sigh of relief. It's far too soon, and we must remain cautious and vigilant. This has been described by many folks as a forest fire. And there are areas in which this fire will continue to seek out pockets where it can burn, or it will smolder in other areas waiting for those flames to be fanned. And until we have a safe, effective, and widely available vaccine, we should all expect to be in that fire tower on the watch and remain vigilant. Of note, in some of the states where we've seen increasing infections, it appears to be amongst younger people, college students, and the like. And it's true that the risk for complications and death may not be the same amongst people in their 20s or 30s, but the risk for the rate of transmission can sometimes be higher than that who are more elderly. Because there's more contact with people, they may be more prone to traveling, and so we must be mindful of how the infection could spread very quickly if people travel across state lines, take airplanes, or frequent places with lots of people without practicing the public health guidance we've been espousing for many months. So we must not let down our guards prematurely. We must continue to follow the guidance. We must wear masks when in public places. We must be mindful of who's in our social circles and who the social circles are of the people that we interact with. We must continue to practice hand hygiene, and we must isolate ourselves if we're not feeling well or if we've tested positive for COVID. It is those interventions that we know from the science to be extremely effective in reducing the transmission. But if they're not employed, of course, they don't work. Now, we know that this is not easy. Right? This is extremely challenging in some cases, particularly now that we're going into our 5th month. All of our lives, all of our businesses, our livelihoods have been fundamentally changed by this virus. And we might be tired or frustrated or concerned at times about continuing up with the same procedures as they're new for us. In healthcare, we too have had to change many, many things. We've changed how we've delivered care. At Mercy, for example, we too screen everybody at the front door, visitors, vendors, patients, and colleagues alike, for symptoms and check their temperature. We all wear masks throughout our facility, and we have changed our safety protocols, including cleaning and disinfection. We've brought in new ways of testing for the virus, from different PCR viral methods to antibody testing. And we've brought in new ways of treating the virus, like convalescent plasma and remdesivir. We have COVID-free zones where you can receive care safely. And we've transformed the way in which we've delivered most routine care to using technology and innovation through telemedicine, so that you can receive care when you need it in the comfort of your own home, safely and conveniently. And as we're now in recovery phase 2, we have begun delivering all elective, non-essential surgeries and procedures and office visits, which means that you do not need to delay receiving that type of care, whether it's colonoscopies, mammograms, or chronic disease visits for diabetes, asthma, or other important matters. We are here for you, and we don't want you to delay your care any longer. because we continue to be concerned that there may be ways in which people have altered their care that could have negative impacts. We continue to see fewer numbers of patients in our emergency departments and in some outpatient areas. We are recovering from our pause on elective surgeries and studies, but we also expect that that return to care is not going to be at the same levels as it was before. And people will want, and we should deliver, care in different and new ways. This will cause us to continue to transform, there is no doubt, both in size and in scope, as we move forward at Mercy Medical Center and throughout Trinity Health. But we take great pride also in continuing to ensure that we do transform to meet the community's needs. It's been the legacy of the Sisters of Providence for over 150 years, and we at Mercy will continue to always be ready, prepared, and committed to meet your needs safely, equitably, often from the comfort of your own home, and with great concern for the health and safety of everyone. So I want to continue to urge you to take the steps to keep us all safe, and thank you for caring for yourself and others. Because what we do now will certainly influence what we can do in the future. We will be dealing with this for a very long time, but I'm confident that we will emerge stronger together.
Thank you, Dr. Sarno. And we're also joined by Patrick Leonardo, the Director of Operations for AMR. Patrick, I appreciate you being here. Dr. Roos and Madam President Nancy will take any questions that you might have pertaining to Bay State and Mercy, and I can let them go on their way. So any questions you might have, Bay State and Mercy? Paul?
The mayor mentioned that we're in a heat wave now, and traditionally the city opens cooling centers for the elderly, and they can't do it because of the social distancing problems. How concerned should people be about, we know that the heat can kill people, so how concerned should people be about this situation? And what advice would you have, I guess, for people that are worried about it?
So certainly, the heat can have a tremendous impact on people's health. And there are times in which individuals, particularly those with chronic medical conditions or the elderly without access to cooling, may be at risk of worsening health conditions. And I would urge people to do what they can with the people that they know and the resources that may be available to them to gain access to ways in which they can cool their residences or other ways. Certainly, with this type of a decision or any decision like this, you have to weigh individual and public health and ensure that procedures that are put into place are appropriate to weigh those risks together. And so I would allow the commissioner and others to comment on that approach from the city, but be more than happy to collaborate and work together on how we might best address this for the city and residents of Springfield.
I certainly agree, and the one thing I would add is also looking, the mayor spoke about cooling station and giving out water. It's important to stay hydrated, and it's important that if you are feeling worse, significantly worse, that you do seek medical care. We are here for you, and it's just something we're going to learn as we go in this pandemic.
Any other questions?
Question for Nancy, actually. I don't know if you can answer this, but I've been following the data of where the cases are coming in across Bay State's hospitals, and there seems to be a consistent, it's like high, numbers that keeps coming in the Wayne Hospital and Palmer. Are you following any particular reason as to why there seems to be certainly compared to Greenfield or Westfield, where there are a lot more people around, why there seems to be some high levels of cases out there, or patients out there?
Well, actually, people seek care not only where they live, where they think that they can be seen more quickly. The reality is, across all of our community hospitals, we have a very low COVID positive rate. This morning there are 0 at Bay State Wing. Actually, in all 3, Bay State Noble and Bay State Franklin, there are no hospitalized patients. So I think as we see patients wherever they decide to go for care, can influence the numbers, but they remain consistently low. in the eastern region.
Is there more of a slow, I know that a couple of weeks ago, Dr. Carwack said sometimes the numbers the state have are behind what the actual confirmation is. Is there just a slower turnaround sometimes with reporting to the state with some of the hospitals that are further out as far as positives? You might have 9 suspected, but really it's maybe only 1 confirmed.
Correct. Well, I would say based on the different platforms available and the reagent, on average our turnaround times at the community hospitals are about 9 to 11 hours. They could be a couple hours less, but that's our average. And I would say at Bay State Medical Center, we have access to the faster turnaround. But I would say we do report all hospitals in totality every day when we report to the state.
And just another question to either one of you. I mean, we were a little early in this, but I know that there was recently a study out of England about dexamethasone. I hope I'm pronouncing that correctly. I don't know if there's any plans or capacity or hopes to be able to try booster testing of that around here. If either you want to speak to that.
At this point today, it is not on the docket. That's not to say when I go back, it might be. So as an academic medical center, we are continually evaluating and going through our institutional research board to decide what clinical trials we will embark upon. So I'm sure it's being evaluated by our teams.
I would just comment, this pandemic has brought a lot of information coming fast and furious at times, and there have been many times in which there have been reports that have come out that have not had the published studies to back up the reports, but have been preliminary perspectives on data. And so until the published studies are out and we can gather a bit more information, there is potential with dexamethasone, as was reported, that it could impact one of the most important indicators, which is mortality. But certainly at this point, we're still reviewing the evidence before we make any alterations to our treatment protocols.
Any other questions or comments for Madam President, Dr. Roots? Okay, hearing none. Thank you so much for being here.
Thank you all.
Thank you for what you and your team are doing day in and day out.
And to you too. Thank you, Mayor, for your leadership.
Thank you, Dr. Roots. Okay, speaking of health, I will now bring up the Commissioner of Health and Human Services, Helen Carlton-Harris.
I'm going to just take a moment to turn these.
Summary question.
Thank you. Turn these around. Thank you, Mayor. Thank you, Mayor, and as always, thank you for your leadership. Thank you for listening and being a partner as we have traveled this journey of COVID-19 and the journey of the second pandemic, racial inequities. The total confirmed cases in the Commonwealth of Massachusetts are 107,061. The Springfield, the Hampden County number, 6,598, which is 6.16% of the state. The city of Springfield, you can see by the bar graph, 2,583. We are 39.14% of Hampden County and 2.41% of the state. As you look at the graphs, you can see we have come a ways from our peak of 104. We, this past week, have an average for the last 7 days of 8 cases. We had one day where there was double digits, which was 13 cases. However, it's important to recognize the residents of the city of Springfield and the work that is currently being done to flatten this curve. We are absolutely so amazingly proud of those individuals who are following the guidance. In addition, the deaths in the city are 117. We are experiencing that 47% are white, 34 are Hispanic, which is 29%, 26 are Black, which is 22%, and 2 Asians, 1.70%. I told you about this last week, but it's worth repeating that on Sunday we had 9 cases, Monday 7 cases, Tuesday 2 cases, Wednesday 7 cases, Thursday 5 cases, Friday 6 cases, Saturday was the high, which was 13, and then Sunday 6 cases. The average age of the positives in the Commonwealth is age 51. Now, if you recall, I said to you for a very long time that that number was 52. So what that means is that when it goes down to 51, the positive cases in age are going down as well. The hospitalization average age still remains 68, and the deaths are now at 81. Again, when we reported in the past, the average age of deaths was 82, which means that in some cases our numbers are going down in terms of the ages that this virus is impacting. The Commonwealth of Massachusetts report since the beginning of the epidemic and through May, the average number of positive cases are down 82%. The number of hospitalizations are down 55%. That's an amazing accomplishment to stand here in a state and know that the work done collectively has resulted in a decrease of 82%, and that really is important. We're moving into phase 2. The second part of phase 2, and many of you will be going inside a restaurant for the first time since March. You will be going to your retail stores for the first time since March. Obviously, there are precautions and guidance that's on our website at the city that each vendor must take in terms of their opening plan. I implore you to understand that this virus behaves differently indoors than it does outdoors. So many of you may feel safe walking around and feeling as if you're in the fresh air. Now, we know even outside there is community spread. However, it is more likely indoors to experience spread and experience the ability of being able to transmit the virus. Going indoors, please remember, it is so important that you do stick to the guidance, and you've heard it over and over, but we will continue to say hand washing is important, social distancing is important, face coverings is important, and staying home if you are sick is very, very important. From the Department of Health and Human Services, I thank them for their continued work, but it's important to also know that we are going into a summer season. When we go into summer season, my staff does work such as larvicide, putting larvicide in the sewers and the storms to keep the mosquito population down. And so while we are absolutely concerned about COVID-19, we are also concerned about those things that we are concerned about usually during the summer, which is controlling Eastern equine encephalitis, which is EEE, and West Nile virus. Now, there's no alarm I'm sounding here. I'm simply saying that the things that we do to protect ourselves, usually during the summer, I'm asking you to continue to do. Try to avoid outdoor activities from dusk to dawn, remove standing water, use insect repellent. While we are, again, focused on this virus, we know that there are potentially other risks that come with summer. The mayor mentioned the cooling centers and the fact that we will probably not open them as usual. We will, however, figure out together how to make sure that we are having some hydration that we can give to our residents. We are working on a plan, so that is very important to acknowledge. We have not forgotten. Homeless population testing, we at this point do not have any individuals in our city who are unhoused or doubled up who have tested positive at this point for COVID-19. I want to applaud those organizations and agencies who are doing the job of keeping, to the degree they can, those individuals safe and following public health precautions. So as we begin, it's important for you to call our hotline should you need to, 413-750-3250. We still talk about testing as being important. We talk about contact tracing as being important, treatment, which our hospitals do, as critical, and we look forward to the day that we have a vaccination, which is when all of us will move forward and be able to make sure that we are protected. I'm just going to spend a minute talking about the Office of Racial Equity. The mayor, I am just so pleased that the mayor is moving forward with this very important office during this time. The mayor has understood and continues to work towards understanding racial equity and assuring that we are bringing this city along with us. And I am so pleased that we will have an Office of Racial Equity. It's important to also know that this office will not move forward without community input from the businesses, as well as the community, and particularly those individuals who are impacted by racial inequity. I also want to remind us that race and racism are two different things. Race belongs to a group of individuals where we identify racism is an action that is taken based on the power of one group who could exercise it over another. And we're talking about structural racism, the way our systems are built, the way our businesses are built. And so this office really is going to have a wonderful opportunity to work with everyone across the spectrum to put in place, hopefully, policies. That's our goal, to have policies that can be implemented that speaks to race and racial inequities. You know, Martin Luther King said that in the end, we will not remember the words of our enemies, but rather the silence of our friends. And so what we in the city are asking is that we continue to have those uncomfortable conversations, that we continue to move forward, talking with each other and to each other, and that will take all of us. So again, I look forward to, my staff looks forward to working this second phase of the second phase as we reopen. We also look forward to working with the administration as well as all who's involved in caring about the issue of race, racism, and equity. Thank you.
Thanks. Thank you, Commissioner Paul-Harris. Thanks. We'll now go to our public safety component, and I'll bring up the Fire Commissioner of the City of Springfield, B.J. Calvin, please.
Good morning, everybody. Thank you, Mr. Mayor. This morning, I'd like to report that we only have one employee out with COVID-type symptoms at the Springfield Fire Department. Things are going well on that front. We continue to have the assistance of building maintenance with their daily deep cleaning of our fire stations, sterilization of all the equipment, and we've got all the proper PPE at this time. I would like to address the other issue we're currently having in the city, which is the fireworks issue. We've had 2 fires in 5 days that were started with illegal fireworks. This is no longer a joke. This is no longer fun and games. Property is being destroyed and people are being injured. This needs to stop. If people cause fires and people are injured using fireworks, they will be held accountable. People also need to realize that these are unlicensed fireworks. The ability to injure yourself severely is there with these fireworks. Each year in America, there are thousands of injuries with people who take off fingers, hands, and some were actually killed using at-home, do-it-yourself fireworks, and people need to be careful with this. Again, do not use these fireworks. They are not safe. There's a reason you have to have a license in the Commonwealth of Massachusetts to launch fireworks. Do-it-yourself fireworks is not a good idea. Do not do it. Thank you.
Thank you, Commissioner Gallo. On the police side, for an update, is the Police Commissioner of the City of Springfield, Cheryl Clapper.
Thank you, Mayor. Good morning. As reported, the police department is down 2 because of COVID, so we're pretty fully staffed and ready to go. And the #1 issue at the police department is fireworks and fireworks complaints. And as I explained at this morning's meeting, it's a little bit different than fireworks in the past, where we would get a complaint about fireworks in a neighborhood and have an address to go with the complaint or have a suspect's name to go with the complaint who's lighting off the fireworks. That has changed now, where most of these fireworks are being lit off in neighborhoods where the people who are lighting them off do not live, do not belong. They're going through the neighborhoods and they light off a brick or a large Roman candle or a large industrial firework in the middle of the street, and then they take off. So it's challenging, it's difficult. They're firing some of these fireworks off from their vehicles as they keep moving. This is challenging. I'm going to have a discussion and a meet today with crime analysis and start using cameras and start getting plate numbers. And if at home in the neighborhoods, if you have home cameras and you think you have some video containing anybody who passes by the front of your house or near your home with fireworks in their possession, or you think that they've been involved in lighting fireworks, if you can contact us and let us know. We're going to have to start using those means of investigations. I still continue to put out details who are specifically looking at fireworks and illegal usage of this. And I support the mayor and the city council and anyone who can come up with a little bit more teeth to enforce the possession of fireworks. Right now it's not arrestable. There's a small fine up to $100. As the mayor mentioned, I'm all for attaching to these fines something that these people need: a license, excise tax, property tax, whatever we can do to make this a more enforceable, stronger violation that catches people's attention, because right now we're obviously missing it. And even if they're younger, people being involved, maybe holding parents or guardians responsible might work too. So we're working on that. We have seized 10 weapons since Friday, semi-automatic guns. We've had the weekend only 1 shooting, and that's being investigated as if and when it happened. But the problem over the weekend was domestic incidents, so we had our hands full with that. We continue to work on the murders. I talked to Captain Duda this morning. There's a lot of witnesses to be talked to, and there's a lot of video to go over, so we're working diligently on that front. Thank you, Mr. Mayor.
Thank you, Commissioner. Before I bring up Superintendent Warwick on our schools, many times I'll get calls. This is happening in many of our neighborhoods, including mine, on the fireworks. You know, Mayor, why can't you just arrest them? First of all, you can't arrest them. 2, if you could, we're pleading with the courts to keep people who are shooting each other locked up, yet they let them out. So this is the dilemma that we face. But I'd like to see, with that home rule legislation, some teeth in it. You hit them where it hurts. If they can't get their license, they can't get their registration, excise tax, anything with a possible city permit that they might have, now they'll think twice about it. But as Commissioner Cowley had indicated, now it is getting dangerous. The last two fires, Bloomfield, three-car garage, fireworks. Orchard Street in the North End, the audacity of that individual or individuals shooting fireworks into a second-floor window, which harmed an individual, is absolutely ridiculous and dangerous. Not to say also, it is very dry outside. And our firemen, our firefighters will have to be called the brush fires. So you think it's fun and games until property is destroyed, somebody gets hurt, or somebody gets killed. So we will confiscate those fireworks, we will catch you, and we look to make an example of you. For everyone, no matter what background here in the city. They're fed up with it, and this just seems to be a phenomenon that is occurring basically in urban America. So we'll stay ever vigilant on it, and let's see what we can do with this home rule legislation. With that, I'll bring up Superintendent of Springfield Public Schools, Dan Warwick, for his update. Thank you.
Thank you, Mayor. Good morning, everyone. As you know, school closed on Friday. We ended our remote learning effort. It was a significant effort in Springfield. We had delivered 17,000 laptops into people's homes, and our participation rates were really encouraging when you look at the participation rates across the state. I attribute that back to the foresight of the school committee, and thank the mayor and the school committee for their support. When about 5 years ago we proposed laptops for every student and put that into place at a time when our budgets were tight. We had to cut in a lot of other areas, but that really helped us. When you look at communities like Worcester that weren't able to invest in laptops, still trying to do work packets, and I was talking to my colleague there on how difficult that was. We were able to actually engage in remote learning. Our participation rates were considerably higher than what I heard a lot of other urbans were across the state, and sometimes up and above some of the suburban numbers, so that was very encouraging. And I just want to thank our staff, the outreach to families. Any family that wasn't participating, the staff at the schools kept reaching out, and they were relentless, trying to provide support and assistance, be that a new laptop or working with them on their internet connectivity or hotspots or whatever it took to get a family to participate. So great job by our staff, and I think that concluded Friday and was a success from our standpoint. That being said, when you move to remote learning, the kids are missing that interaction with the teachers that you have in a classroom situation. So what we did was, in planning our summer school this year, we actually expanded what we're going to be able to offer for summer school rather significantly, because we know that there was loss, and especially with some students who, in spite of all the efforts, weren't able to participate. So we're running all our credit recovery and traditional remedial summer programs that we've always run. In addition, we're going to run an enrichment program for all of our students to participate in. And we're going to leave all of our laptops out so the families can use them over the summer. So again, that'll be ongoing during the summer. The dates of our summer school program are going to be July 6th through August 6th. It's going to take place from 8 to 1, but 8 to 11 will be direct instruction, and 11:30 to 1 will be follow-up with the teachers. During that time, we're going to keep our feeding program going. So we're going to continue to distribute meals for families through all of our 17 feeding sites that go Monday to Friday, as well as Central on Friday. The good news on that is when we closed school, we had distributed, as of Friday, 1,294,268 meals to families. So we're going to go over 1,300,000 today. That's going to continue all summer. For the weekend, we distributed 69,684 meals. We give meals on the weekends to families to go all through the weekend, Friday, Saturday, and Sunday. So that was very successful. So we built the summer hours around the families still being able to go over and pick up those meals during that summer program. Our graduations, again, I commend our high school principals, were very successful. Our virtual graduations, the viewerships were very, very positive. Great events. I really thank Focus Springfield. They really put a tremendous effort into putting on quality virtual graduations. And our principals and the staffs at every school set up a live experience that was appropriate and very well received by our families. Fall reopening, you know, there's a million questions on fall reopening, and I have a lot of questions on fall reopening. But the Commissioner of Department of Elementary and Secondary Education is going to be getting guidance out, where we're going to work with our health department to make sure the model we put forth will take into account the educational pieces, but also the safety pieces that are going to be so important for our families. My guess now is that some kind of hybrid model will be put forth statewide, which will be a combination of classroom instruction, adhering to the social distancing guidelines with reduced numbers in school every day, and a combination of remote learning from home going on also, so we can adhere again to those social distancing guidelines that we're going to have to deal with in school, but also on the buses on the way to school. So we're reaching out to all our families, finding out their preferences. Some families may choose to just stay with remote learning because they have a fear about going into school. We're going to honor that request for a family that makes that request. There are also families that qualify for transportation but are going to choose to transport their child, again with a safety piece in mind, and we're going to honor that request. So we're reaching out to all of our families, finding out their preference, and we're going to attempt to design a program around those preferences for the fall and have that out and ready to go. I have a great team working on that, and our health commissioner, Helen Carlton-Harris, has been very, very helpful with the health department, because that health and safety piece is a crucial piece. Thank you. Thank you, Mayor.
Thanks, Steve. We had our school committee meeting this past Thursday evening. It was went for quite a while. It was a good meeting, and I think nearly 70% or so, nearly 70% are going on to college, and Superintendent Warwick had reported multi-millions of dollars of scholarships, which was fantastic on that. Wearing a couple different hats, the Wizard of Oz, Pat Sullivan, who has the parks, and his team has done a wonderful job of facilities management as we continue to keep buildings open via appointment, and the feedback's been very, very good, and all the cleaning that his team and staff continues to do. Park Superintendent Pat Sullivan and Facilities Management Director Pat Sullivan.
Thank you, Mayor. Good morning. As the Mayor indicated, our splash pads will be opening next week, and we're very proud to be offering this recreation resource to the residents. We are also preparing and consulting with our health department, Helen Carlton, movies in the park. We would be very excited to offer those, and we feel that could be a safe program under the Phase 3, and we're awaiting the governor's guidance, but we feel confident by mid-July we could be offering that program. I just also would like to thank our residents, both visiting the parks and our municipal buildings, for your cooperation, and our frontline staff that continues to clean both the parks and the buildings, for their support as we navigate the COVID crisis. Thank you.
Thanks, Pat. Done a great job at the parks. I know my daughters take their bike rides in Forest Park, and a wonderful job with all the challenges. We appreciate that. Speaking of things keeping going, DPW Director Chris Signoli, again, to all the DPW workers who have been out there day in and day out throughout this COVID-19 coronavirus, picking up the trash, recycling, yard waste. Street sweepers are back out, and street work continues. The intersection down there at Belmont Locust Mill looks fantastic. I know they're working on the roundabout at Six Corners and other areas where traffic lights and other things are going in. So without further ado, DPW Director Chris Signoli.
Mayor, thank you very much. Just to mention one item that the Mayor had mentioned, since the beginning of this pandemic, our DPW staff, operations, solid waste, has worked every day. We have not stopped doing any of the work that we do around the city, so I really need to thank them for their time, their patience, and making sure that everything gets done in the city. Currently, right now, the DPW has 1 employee out with regard to COVID. Over the last 2 weeks, the city has processed a number of the outdoor dining applications with all of the other departments, including DPW, and those have gone very, very well. The Tapley Street building is open for business, so people who need to deal with building, retirement, etc., the building is open through appointments. The DPW has also started all of our meetings back up again. We held Board of Public Works last week for referrals to the City Council. And as the Mayor mentioned, we have a number of projects under construction right now. Central Street project will be starting in the field. It has been awarded, a contract's been awarded for that project. Bay and Berkshire, and we will be advertising for Berkshire Cottage and Harvey Street reconstruction through Mass DOT within the next 6 weeks or so. And that is it with regard to DPW. Thank you.
Thank you, Chris. Thank you, Director Spinola. As I always say, Springfield's in the business of doing business, and Chief Development Officer Tim Sheen and his team have done a great job getting out $1.225 million in grants to our businesses, small businesses, restaurants, and now businesses that have been shuttered to try to get them reopened. We also, through Tim's efforts, $2 million HUD money to help out our residents that are having a little trouble paying their mortgages, rents, and utilities. $2 million, we're using Peter Gagliardi at Wayfinders as our conduit facilitator. He believes we can help out about 1,000 families. And again, if you can keep them in your homes, more positive outcomes come forward. And Tim's, we're working on a few other initiatives that will be announced in the near future, but without further ado, Chief Development Officer Tim Sheehan.
Thank you, Mayor. We're thrilled that the restaurants are able to provide indoor dining starting today, and that more businesses are being allowed to reopen. With that, as the Mayor indicated, under the Phase 3 Prime the Pump that we announced last week for an additional $500,000, that funding is targeted towards assisting businesses in meeting the cost associated with reopening and some of the costs associated with the emergency orders that they would have to implement in order to reopen. With that, we also are looking at, as businesses begin to reopen, the economic impacts that have happened in the city with regards to unemployment and workforce training and re-engagement, particularly within the Black and brown communities that have been disproportionately impacted economically because of the virus. That program is just in its early phases of planning, but hopefully we'll be able to announce that in the upcoming week or so. With that being said, we continue to advance our funding looking at community economic security and housing stabilization. And we will continue to do that as we move forward in meeting the needs. Thank you.
Thank you, Director Sheehan. Thanks, Tim. Received a legal update today. I know Solicitor Pakula is here and Attorney HR and Labor Director Bill Mahoney. I don't have anything else to add, but I appreciate their legal update. So I think we have everybody with that. I will open it up to questions of the cabinet heads or myself.
Mayor, what are some of the things that you're looking to go after with this home rule petition for the fireworks? You mentioned the driver's licenses.
Driver's license, registration, excise tax, anything that's tied if you're doing some city business. You got to get their attention. They've obviously gotten the attention of my residents, my business community, my fire department, my police department. I'm not happy about it. So we might not catch you right away, but when we do, I don't want to make it hurt, so you remember. So you need a license. You gotta get a car registration. You gotta pay your excise tax, and when you go to renew that or do that, or maybe you have a city permit that you're getting something along the lines. Mr. Smith? Well, I'm here for, you can't get it. Why not? You get a $300 or $500 fine there for illegal fireworks and perpetuating dangerous activities. What? Until you pay that, you can't move forward. You want to move forward, pay it. And then you're going to probably think twice next time you want to start blowing off some fireworks. And some of the stuff that's being blown off is heavy artillery stuff. And I need that, you know, I know kids or younger people will be kids at times within reason, but it's still not right. But now you're getting where Commissioner Calvi, his men and women on fire, are getting called out for fires being started by fireworks. You're getting people who are getting hurt. Orchard Street in the North End, where police have to respond. That individual was hurt shooting fireworks through a window. And then it's just so dry out, a brush fire can take something up like that. So you got to make them be able to listen. You're not going to get everybody, because some, doesn't matter what you do, you're still going to do it. But this has become an epidemic, and especially you read about it across urban America where this is occurring. And it's not right, and it's not fair to all the citizens, no matter what creed, color, and background. So get their attention, and that's the way we're looking to do it, and I believe you have to do that through home rule legislation, and I would be hopeful that the council would do that, and I would be hopeful that the delegation would look forward to do that. Again, I don't know if there's any legal hurdles, but somebody's going to get hurt. Some place is going to burn down. Somebody's going to get killed. And they're going to say, what the hell did you do about it? And I need families to step up. Minister Alexander, what she had said, they need to do their part too. They need to be responsible. They need to be responsible. On the private pump part rate, what businesses are you looking to help? What types of businesses might be eligible? I'm going to bring Tim up. We've had some that have gone after a couple of rounds with us, but they haven't been able to technically, they couldn't open. Right. So we want to get them going. So Tim will speak a little more specific to that. Director Sheen?
We're looking at all for-profit businesses at this point. As I've indicated a couple times at the podium, the nonprofit community, we're trying to figure out how best to address that, but the differences between the for-profit and not-for-profit are different, obviously. So we have to figure out how to analyze that so that our funding can assist the nonprofits. But this is open to any for-profit business. So what are some of the expenses, though, that might be eligible? Because I know earlier, in the first phase, it dealt with restaurants converting to takeout and that sort of thing. What are some of the expenses that might be eligible in this third? So if a business has been closed, and for example, if they have past due rent, if they have past due expenditures for inventory because they haven't been able to pay for that, because no business has been coming in, that would be an eligible expense. If they have anything that's related to implementing into their business as a result of the emergency orders related to COVID, all of that would be eligible. If they had issues associated with reemployment of people, that would be eligible. So it's pretty broad. Thank you. Yes.
Tim, actually, while we're up there, just curious, you got a sense, we know that like the economic impact in terms of like sectors that are going to be hurt, obviously entertainment and hospitality. Are you seeing anything else in the city that might be, struggling longer term in terms of its economy as a result of the outbreak, as we're starting to come out of the lockdown itself?
Well, I think that any employer that has manufacturing and assembly operations, they have more challenges related to personnel. I also think that Obviously, education is going to be an issue in terms of how higher ed is getting re-engaged. I think that for example, the larger institutions such as Mass Mutual are looking at remote working for a protracted period in time, and that could be how they go forward in the future. So I think that there's also big impacts with regards to commercial real estate. So this is going to be with us for quite some time, and there's going to be some dramatic changes in how business is done.
Yeah, Matt, you look at it with some college towns. If the students aren't coming back, that affects all the ancillary businesses that are in that area. You look at pro sports. I know people are thinking of playing of the ball games, but it affects all the ancillary businesses in the area there that are able to live off the patrons and fans coming there. And I think Timmy brought up a good point. We are seeing now that businesses have been able to survive and maybe some thrive or be able to move forward on a remote basis. So some might continue to do that, and that cuts down the square footage of physical plants of property, and that comes into the equation too. Any questions?
I've got a question for Pat.
Sure, Pat.
On the splash pads, which you said you're going to open next week, are there going to be capacity restrictions there? How does that all?
There will be signage, and we are depending on the parents and guardians to assist us with that. We will have the hand sanitizer at each of those locations. We will have staff that makes rounds throughout the day to clean the areas, but it will be very dependent on our residents as we do with the playgrounds and so forth, to use common sense.
Have you noticed with the playgrounds that people have been pretty good about?
They have.
Okay.
Yep, no, it's gone. Everything that we have seen, we've gotten very little, if any, complaints, and we are so appreciative of our residents realizing what they have to do, and I think the numbers that Helen shared today show that, and I think when you hear what Dr. Roos explained, what's happening in the other 20 states across the country, when you don't do it, you see the impact. So we will monitor, and we hope that we can keep them open.